All right, I have arrived on scene. The scene appears to be safe. I'm wearing my BSI. Looking around, I see one patient on the ground, no other patients in sight. I see no bystanders. It looks to be about even terrain, clear weather, and it's about 1:30 at night. So it does not seem like I'll need additional assistance or equipment at this time. My general impression on the patient so far is he seems to be in his late teens, early 20s. Seems to have suffered a severe trauma. He's not moving. I'm going to direct my assistant to apply manual C-spine to stabilize his neck and spine. And then I'm going to enter and start my primary assessment. Not starting my primary assessment. Start my initial assessment. I'm going to start by assessing his responsiveness to verbal stimuli. He's not responsive. Next, I'm going to try for painful stimuli. He is unresponsive. Next, I need to assess his airway. I'm going to perform a modified jaw thrust. I'm going to look, listen, and feel for breathing. He seems to be breathing. His it sounds like he's snoring. He's got about 36 breaths per minute, and they're shallow and rapid. Next, I need to measure and secure an OP and an NP. He accepts those. His respirations seem fast, so I'm gonna direct my assistant to apply BVM at 12 to 20 respirations per minute at 15 liters per minute at 100% O2. It doesn't look like he needs suction at this point. Now I need to look at his neck for JVD or tracheal deviation while he's breathing. Doesn't appear to be any of that. I'm going to assess his chest next. There appears to be bruising on his left lateral, the left lateral side of his chest. There's a little bit of deformity and crepitus too. I'm going to take note of that. Next, I need to assess his circulation. I'm going to start radially with the capillary refill. Next with his radial pulse. And then with his carotid pulse. His pulse seems to feel weak and rapid. It's at 140 beats per minute. I'm going to check for hemorrhaging next. I'm going to check my gloves for blood as I go. I'm going to go down the whole body. And it appears that he's not bleeding. No signs of hemorrhaging. I'm going to check his skin next. So it looks pale right now in appearance. It feels cool and it feels moist. So his skin is pale, cool, and moist. My initial assessment is that he is a high priority patient who is in need of immediate transport. I'm going to call the trauma team and paramedic to intercept right now. I'm going to send my assistant to get the longboard and the C-collar to help stabilize him, and I'm going to move into my primary assessment. I'm going to start up at the head with DCAP BTLS. There doesn't appear to be any deformities up here. I'm going to move on to the neck next, check for any deformities, any tracheal deviation, check for any changes in the JVD. There doesn't appear to be anything here. The airway still looks secure. My assistant is going to place the C-collar on right now. I'm going to move on to the shoulders next. I'm going to palpate? Palpate. Okay. I'm going to palpate the shoulders and the clavicles. Everything seems fine here. I'm going to move on to the sternum next. The sternum seems to feel intact. I'm gonna check the chest walls next. I'm gonna avoid the left lateral wall because I want to avoid the crepitus and deformity. I'm gonna assess the right wall though, and this seems to feel intact. I'm gonna check for chest expansion next. The right side seems to feel like it's expanding normally, and the left side seems to have decreased expansion. I'm gonna check his lung sounds next. I'm gonna auscultate each lung. This is my stethoscope. The right lung looks fine, and the left lung sounds weak. I'm gonna move on to the abdomen now. I'm gonna palpate here. Seems unremarkable. I'm gonna move on to the retroperitoneal on each side. Unremarkable here. I'm gonna move on to the pelvis next. Make sure to push in on the sides and not on top. Everything seems to be fine here. I'm gonna expose the lower extremities next. The left femur seems to be swelling out right now, and there's some discoloration too. So I'm not gonna do any palpitations here. I am gonna note the size in comparison to the right leg though. It's a lot larger. I am gonna palpitate on the right leg though. Right leg feels fine. I'm gonna check for a distal pulse on the left leg, on the left foot. I don't feel any pulse here. I'm gonna check for distal pulse on the right foot. I do feel a pulse here. I am gonna move up to the arms next. I'm gonna start with the right arm, do my palpitations. I'm gonna feel the distal pulse. The pulse feels weak. I'm gonna check for capillary action, or capillary refill. And that seems normal. I'm gonna check the left arm next. And check distal pulse. And the pulse feels weak. I am gonna roll the patient onto his side now because my assistant has gotten here with the longboard. And while I roll the patient, she's gonna make sure that the C-spine is held steady and that his neck isn't moving. While on his side, I'm gonna check for any deformities on the back and on the spine. Seems unremarkable. We're gonna slide the longboard in here. We're gonna roll him onto the longboard. And from here, we're gonna transfer him onto the stretcher, still on the longboard, and he's gonna go into the ambulance and transport to the hospital. And from there, we're gonna start the second assessment.